My name is Nicholas Vandenhever. I'm the Program Director and Dean of the Masters of Science in Occupational Therapy at West Coast University. Occupational therapy is a healthcare profession aimed at enabling people to live life to its fullest and have quality of life. For us as occupational therapists, quality of life or a full life means that the person is fully engaged in the activities that they want and need to do. No matter what injury, illness, condition, disability, lifestyle, or environment might stand in the way. These everyday human activities are what we call occupations, and they are the building blocks of our physical, psychological, emotional, and spiritual health. Occupational therapists work with people across the lifespan, from the newborn to the elderly to the end of their life. As OTs, we consider ourselves a holistic profession. Of course, we deal with any physical, cognitive, or emotional issues that keeps the person from succeeding in the areas important to him or her. The occupation in which our clients engage can include activities of daily living, education. It also includes activities that we use to care for ourselves or others, household management, financial management and childcare, leisure, play, and our social participation as well as work. You can find occupational therapists working in the military, in schools and hospitals. We work in the nursing homes, pediatric private practices, and wellness programs. You can also find OT in community agencies, substance abuse rehab and mental health rehab, and many more places. In hospitals, OTs play a very important role in the discharge process and making sure that the patient will be discharged safely so that they will be as independent as possible and safe as possible when they go home. Pediatric occupational therapists work with children in sensory integration therapy with the goal of helping children with autism and other disorders. School-based therapists might also help children who struggle with fine motor activities such as handwriting or using scissors or feeding themselves. Occupational therapists work with people who had traumatic brain injuries or strokes. They might take a brain-injured person to a grocery store to help them relearn how to shop, or to a crowded mall to help them find strategies to cope with overwhelming situations. This is really a good example of the holistic nature of occupational therapy. We work with every body function that is affected by the illness or the disease process. A career in occupational therapy requires a master's degree for entry level, although many people also earn an entry-level doctoral degree. A therapist then must pass an initial certifying exam given by the National Board for Certification in Occupational Therapy, and then has to be licensed by their state. Each state has its own licensing and continuing education requirements. The need for occupational therapy in the United States is going to increase. There is a projected growth of 34% in the next 4 years with the new Healthcare Reform Act. Occupational therapy services is going to be made available to larger groups of the population like autism and aging in place or the elderly population. Many financial magazines listed occupational therapy as one of the top 5 healthcare professions of the future.